Hello, my name is Sky Richards, and today I will be presenting on LGBTQIA+ youth and sex trafficking. This presentation will include an overview of sex trafficking and LGBTQIA+, the goal of this project, the importance of this topic, the project methodology used, the significance of findings, and their implications. The population of this presentation focuses on LGBTQIA+ youth. LGBTQIA+ is an abbreviation standing for lesbian, gay, bisexual, transgender, queer, intersex, and asexual. The New York Times states that the plus denotes everything on the gender and asexuality spectrum that words can't yet describe. I'll be using the term LGBTQIA+ with this definition throughout the rest of the presentation. Specific to LGBTQIA+ youth, this presentation looks into this particular population's connection with sex trafficking. Sex trafficking is one of the many forms of human trafficking, along with forced labor and domestic servitude. An individual who's involved in sex trafficking is also considered a victim of human trafficking. Shared Hope International, which is an organization whose efforts involve restoring women and children enslaved in sex trafficking, defines sex trafficking as when someone uses force, fraud, or coercion to cause a commercial sex act with an adult or causes a minor to commit a commercial sex act. They continue the definition by explaining that a commercial sex act includes prostitution, pornography, and sexual performance done in exchange for any item of value such as money, drugs, shelter, food, or even clothes. The goal of this project is ultimately to raise awareness of sex trafficking occurring within the vulnerable LGBTQIA+ youth population by uncovering and identifying risk factors, significant findings, and health implications. The hope is to inspire policy changes and structure of aid for these at-risk populations. Unfortunately, for LGBTQIA+ members, victimization from peers and family members can lead to mental health problems, higher vulnerability, and homelessness. As you can see on the graphic on this slide, the U.S. National Human Trafficking Hotline states LGBTQIA+ youth without safe shelter and social supports are at a higher risk for trafficking and exploitation. Traffickers are able to prey on these vulnerable individuals by creating a false sense of trust, love, and affection by establishing the groundwork for fulfilling basic needs, of being a social support for the individual, and even protecting them. The traffickers can identify the needs of these vulnerable youth and provide in all the areas the target may feel they are missing or lacking in their life. When the trust and loyalty or fear and abuse is established, the control the trafficker has over the vulnerable individual is tremendous. Due to all the factors of potential rejection and lack of support on top of discrimination, harassment, or violence, individuals within the LGBTQIA+ population are disproportionately at risk for trafficking, violence, and homelessness. With homelessness, there is often an increase in engagement of survival sex, along with unwanted engagement in sex trade. This graphic depicts data from a 2018 study done by Morton et al. On the topic of LGBTQIA+ youth homelessness in America. The study used multiple research components to create a more in-depth and complete perspective on the topic. They found LGBTQIA+ individuals have higher percentages in every category compared to their non-LGBTQIA+ counterparts. The areas I want to highlight are the 38% of LGBTQIA+ individuals compared to 15% of non-LGBTQIA+ individuals who were forced to have sex, and 27% of LGBTQIA+ individuals compared to 9% of non-LGBTQIA+ individuals who exchanged sex for basic needs. The other statistics are important to note as well when considering the risk factors touched on earlier, such as discrimination, lack of social support, and violence. To start this project, I started by collecting credible information by using online search engines and databases such as Google, Google Scholar, and Academic Search Premier. When searching, I used keywords such as LGBT, trafficking, sex trafficking, human trafficking, vulnerability, transgender, gay, queer, youth, adolescents, young adults, and the United States. I searched a combination of these terms such as LGBTQ, LGBTQIA, and youth, and sex trafficking vulnerability. By using a variation of combinations, I was led to a mixture of primary and secondary resources. Ultimately, I retrieved 30 resources, and from there I used my own criteria for the sources to narrow them down to 15. Each source had to have a date of publication within 10 years of the current year, which is 2021. They also had to focus on LGBTQIA+ youth and focus on sex trafficking. I was able to narrow down these findings to 5 journal articles, 4 news articles, 3 informational PDFs, and 3 books, which created an overall multidimensional view into the world of LGBTQIA+ youth within sex trafficking. The findings from the journal and newspaper articles were all quite similar, all suggesting and supporting the notion of the limited visibility of the LGBTQIA+ populations and the vulnerability to sex trafficking which comes with that. There was a lot of focus on the risk factors and why these populations were vulnerable. Much of the data included information about certain demographics, sociological factors, effects of company enablement and exploitation, and criminalization. There were also articles focused on the tactics toward helping these underserved populations through community, healthcare, and government involvement. Unsurprisingly, the numbers for sex trafficking were highest among homeless youth. Statistics from the Covenant House International Organization's sex trafficking study from 2018 are shown here on this slide. As you can see, trafficking among drop-in youth or street youth was 24%, and 29% of LGBTQ youth were identified as human trafficking survivors, compared to 17% of straight youth. Here, more data is shown showcasing the high levels of sex trafficking rates among LGBTQIA+ members. From the research found, need for basic necessities leads to manipulation and engagement of commercial sex acts. As stated earlier, LGBTQIA+ individuals tend to engage in survival sex as a way to generate income, and this leaves them as targets for traffickers because they can sense the fragility within their familial relationships, and ultimately, these traffickers can cultivate a false sense of security. Interestingly, there were findings to support many of the individuals who were in the sex industry did not identify themselves as a victim of trafficking, even though many of them were exposed to high levels of exploitation, coercion, violence, and trafficking. The message from these articles was clear. There needs to be better communication and support from the community, healthcare and law enforcement, and government to protect this vulnerable population. Even with the information found, there's still a lack of information on a few select populations within the community. There's a lot of underreporting within trafficking data, particularly when victims are male, transgender, or a migrant sex worker. Resources need to be better tailored to these communities. Since this population is at a higher risk for violence and discrimination, there's much that must be done to aid these individuals. There needs to be necessary reform to existing anti-trafficking legislation by use of better resources and support, and less punitive measures and discrimination. Changes in both legal and public health fields need to occur, as this topic is commonly overlooked. Legal professionals and public health providers will need to educate victims and the broader public about the resources available for LGBTQIA+ victims of sex trafficking. Martinez and Keel suggest local law enforcement agencies implement a variety of policies to encourage the reporting of sex trafficking of LGBTQIA+ individuals, emphasize the criminal nature of these offenses, and address the code of silence and stigma associated with the crimes. As governmental policy and education around LGBTQIA+ matters increase, more individuals do feel comfortable coming out. Working toward decreasing stigma can aid in the decrease of hate, prejudice, and misunderstanding, leading to a decrease in unsheltered and homeless youth. A decrease in homeless LGBTQIA+ youth leads to a decrease in sex trafficking and spread of STIs, disease, worsening mental health disorders, and even possibly death. There also needs to be an emphasis on the importance of trust between those in healthcare settings and the LGBTQIA+ youth in order to provide better outcomes for these individuals. To support this population better, there needs to be education on identifying the red flags of sex trafficking, and particularly the signs within these communities, the socioeconomic susceptibilities these individuals face, adapted methods to speak to LGBTQIA+ youth, such as using inclusive language and terminology, and provision of helpful resources specific to the target population. A study by Martinez and Keel from 2013 suggests that legal and health agencies working toward leading initiatives to increase the awareness and promotion of health services and targeted resources will be helpful in addressing the growing health needs of this vulnerable population. Ultimately, by promoting awareness and education while also advocating to change policy around the criminalization of traffickers and the increase in services for sex trafficking victims through the channeling of resources toward minimizing the invisibility of these groups, this current vulnerable and susceptible population of LGBTQIA+ youth can be better served and hopefully better protected from sex trafficking. Thank you so much for listening to my presentation. My resources are as follows, and I very much appreciate your time. Thank you.